Assalamualaikum. Communication scenario is that mom, Mrs. Aisha 30 weeks of her pregnancy, and at that time antenatal screening shows that there is cleft lip and cleft palate, and she is very upset. So task is talk to Mrs. Aisha and regarding her concern. So, hello, good morning. This is Dr. Roxana, one of baby doctor here. Am I speaking to Mrs. Aisha? Thank you for coming. So today I have made this arrangement so that nobody can disturb us. So, Mrs. Aisha, would you like to attend anyone in our this meeting? Okay. So, Mrs. Aisha, now our agenda. So, Mrs. Aisha, I came to know that you are very much upset regarding the jelly skin report, and I'm here to give you all of your concern, all the answer of all of your concern. And at first, I'm so sorry to hear about this also. So mom is very much upset. First of all, how far you know about this? There is about the result. So we are disclosing the prior knowledge of Mrs. Aisha. Yes. Mrs. Aisha may say that there is there's a cleft lip and some palate. Yes. So how far you know about this? So then we may draw the picture, or we may show on our face. So the cleft lip and palate. Cleft means there's a gap between this type of gap of the lip and the roof of the mouth. This gap of the lip is called cleft lip, and if it occurs during in the roof of the our mouth, it is called cleft palate. Are you with me? Okay. So, and why it occurs? It occurs during when he is growing in your womb, and that time the fusion of these two plates is not properly occurred. And then we will give some pause because it's a breaking bad news, and so much empathy and sympathy is required. So that am I responsible is that most of the cases of this cleft lip, cleft palate, the causes are known, and nobody, especially mom, is not responsible for it. So mom may tell that as there is a gap, what may be the problem? Yes, I can find that you are very much, or it's actually your pregnancy, and this news is a difficult condition for it. However, I want to tell that the problems that may occur, there may be in feeding difficulty, hearing problem, speech problem. Feeding difficulty, doctor, my first baby and I want to give him breastfeed. First of all, after delivery we have to check your baby, and then there may be some problem giving the breastfeeding. So we can give it by a special feeding tube. How it sounds? Okay, doctor. So you are telling about that there is chance of the ear problem and speech problem. Yes, you are absolutely right. That the thing is that there may be this type of problem. So we will keep your baby in our follow up, so that we will follow up any glue ear is developing or not. If developed, so we will act accordingly, and we will also provide the speech and the language therapy if we feel that is necessary in this case. And there may be dental problem, we will involve the dentist in this case. Are you with me? Yes, so when will this operation done? Actually, it done cleft lip. In this lip operation is 3 to 6 months, and cleft palate is 6 to 12 months. Okay, so but I'm very much afraid that my little child with this kind of operation. Yes, your feelings is understandable, but I can show you the picture of the baby who undergo this type of operation, before operation and after operation, and that after seeing you can feel that he is completely normal. And there may be actually after the operation there may be mild pink scar on the lip, but however with the when the child grows it will fade. Are you getting me? Okay, so do you have any other concern? And there may be another question, that is there any chance to develop this condition in my next baby? Actually the thing is that the chance then the general population will increase in the further pregnancy. However, we will keep the baby in our future in our follow-up, so that we can overcome it. And do you have any other concern, or then summarization giving the leaflet? And wish all the best. Thank you. Assalamu alaikum.